Being a mom is hard. There's lots of different things that happen when you have a child. You still have a job, you still have your whole life, but you also have an additional responsibility.
Some women are suffering and enduring things that are not just part of the normal challenges that you deal with being a mom and motherhood in general, and there are treatment options.
Most women are scared about coming in for a psychiatric assessment. A lot of times, definitely during pregnancy and postpartum, it's the first time they've ever accessed care.
Pregnancy and postpartum are really vulnerable periods of time in a woman's life for underlying psychiatric disorders to come about. So having access to care during those times is really important.
We know that women who are pregnant or who experience anxiety, those things affect their fertility. It's often in their interest to have their depression or anxiety managed before they embark on fertility treatments.
Often these women come in and they have no understanding of what medications they aren't allowed to take, and they're very afraid to take medication because they don't want to do anything that will hurt their baby.
We need a focus on women's mental health so that there's somewhere for pregnant and postpartum women to go and get care without stigma and feeling bad, and also feeling scared.
There's a huge demand for these services, and there are a few providers who can do it. And Meridian is hoping to offer it in one spot.
In terms of what we can do for women here is sort of assess biochemical needs, assess support needs, and really normalize things for women, that it's okay if you're scared, it's okay if you're sad, it's okay if you're like, what did I do? That this is all normal.
I think people are very, very interested and excited in what we're doing in terms of availability and resources to create an appropriate and adequate team to kind of provide this kind of level of support, because there's a lot of women that I think need this help.
We want to be able to help women be able to enjoy motherhood to their fullest, and where they're physically and mentally at their best to be able to do that.
I really want to create a warm environment and say whatever you're feeling, whatever you're experiencing is okay.
Meridian does a great job of making people feel welcome and cared for from the beginning with our wonderful intake workers and kind of all the way through the process and coming to see us. I think it's really collaborative.
I have many patients where we make decisions together about if we feel comfortable continuing the medications, do we want to come off? We're really here to help you make those decisions together.
I'll use my expertise to recommend and guide, but ultimately I want to be a team with my patient, be able to make a decision that best meets an individual's specific needs and goals.
There are many options to help you achieve wellness while you embark on your reproductive journey. If you're already pregnant and you're not feeling your very best, there are many safe options for you to perhaps treat your sadness or your anxiety. I think accessing information and services is really important to any woman who is embarking on their reproductive journey.
At the end of the day, it is your body and your choice. And the purpose of having a perinatal psychiatrist work with you is to frankly open up opportunities and treatment options.
I think our patients feel like their health is the priority of everybody at Meridian. They can also feel welcome and safe to be their authentic selves.
They have the opportunity to really find providers that can meet them in the middle and be able to, cater to their individual needs.
Whether that patient accepts my full recommendation or only part of my recommendation, I'm going to be their psychiatrist no matter what. It's my job to provide them information, and then I need to sit back and be able to respect their decision.
Meridian is the place to go for psychiatric care in women's mental health because we have the commitment to the care, we have dedication to the care, we have knowledge to be able to provide the care in an open and very understanding environment that makes everybody feel comfortable.